Dell, but it's very important. First, you looked at the 4 papers that claimed to isolate the virus. You found out they never isolated or purified the virus, right? I know you'll explain about that in a minute, and I know you've said it again, right? And then, like, you rejected both hypotheses that the virus SARS-2 and COVID-19 are the illnesses. Okay, so if that's too complicated for most people, I know maybe you can help clarify that a little bit for people in a minute. But okay, look at the numbers of the people that have died. Look at the things. Look at the empty hospitals. I speak to doctors and nurses here in Devon. The hospitals were empty. I know people have died in those hospitals. A lovely man near me, who I love so much, he helped me when I first came to the town. His family couldn't go and see him when he was dying. It's disgraceful. So I'll tell you, when we talk about Fauci maybe later and Obama and all these people, that's murder. It's murder. It's like in Iraq. Who's to blame? Bush, Blair, or the weapons manufacturers, or the person that's dropping the bombs out of the plane? It was on a lie, and millions of people have died. Same thing here, right?
Absolutely. And, it really was cruel and inhumane how people were treated in hospitals and nursing homes, what you were talking about, without, prohibiting their families from accessing to visit them in any way, that they had to die alone around strangers. And also that, at least in the United States, there's lots of evidence that they were not doing any life-saving measures for people, even if they wanted it. They were going against their family's wishes. They're coercing people to go on ventilators, even though it was not indicated, because they were skipping all these steps because supposedly they could spread an imaginary virus around if they gave more oxygen or used positive airway pressure machines. So all of these policies, like this very minor mortality spike that occurred, and I can speak most specifically about the United States because it's very complicated to look at this data. You really have to drill it down to a level of granularity in order to understand what was really going on to explain these deaths. So what we had in the United States is that there was a spike in mortality that occurred in a very, very short window of time. Essentially, it's been over now for almost 2 months, even though we still have these measures going on. And you can see what the media did is they stopped talking about deaths and they started talking about cases. So they could just basically, if they test more people, they'll get more positive tests and they'll call those cases and they can skew the numbers there, right? But I'm talking about when there were actually people dying, and it occurred from about the end of March until the middle of May, about a 5 to 6 week period. And if you look at this on a graph, like for the United States and many other countries mimic this, you'll see it's a very extreme peak. Right, like the number of deaths rose up super fast and then came down almost as fast. And this tells you that it is not typical for a virus peak. Like if you look at, what they call a virus peak, like for the seasonal influenza, for example, which would be much less of a steep rise and spread out over a longer period of time. So it had unique characteristics. Now, if you look at just the total number of deaths compared to the last year, it's not even statistically significantly different from prior years. Okay, it is higher than the average of the last 3 years, but there's no statistical significance to that difference because, there's variation from year to year. So this would just be a year with a little bit higher mortality. But it still merits explanation because it occurred in an atypical way. It wasn't spread out over time. It was in this very short window of time. And what you had going on at that time was it was right after the World Health Organization announced pandemic status. And then there was a reaction to that all these countries all over the world and all the states in the United States started passing these house arrest procedures right after that. And they shut down all the businesses at that time. And then they shut down all the hospital beds for non-COVID related illness, right? All the elective procedures were shut down. The ERs were pared down. People were intensely afraid because that's when you had those predictions like by Neil Ferguson, right? Where I think, 20 million people or 200 million or, whatever these crazy numbers were predicted to die. So everyone is suddenly panicked. They're out of work. They're stuck at home. They're indoors. They're without healthcare services. Their businesses are failing. So you basically injected extreme chaos and turmoil into the situation. And whenever you inject chaos and turmoil into large systems like this, you're going to have bad outcomes. And so that's what we saw, is we saw that some people died, and we don't really know the exact number, because the way that the cause of deaths was recorded was all erroneous, right? It's well documented that they encouraged and even forced doctors to put COVID as the cause of death for like virtually every death, right? You see, even like if they died of a heart attack, there was a recent article in the Daily Mail that someone tested positive for COVID 2 months ago and then died after being hit by a bus, and they put COVID as the cause of death, right? So you can't look at those numbers and get any truth out of there. You have to look at all causes of death, right? So it's hard to say, because also one policy that they went against is they didn't do autopsies. Normally in a public health emergency, you'd autopsy everyone that died suspiciously, because that's how you determine what's going on. In this case, they ordered no autopsies to be conducted. They prevented them. And so it's impossible to know exactly how those people died, but I'll tell you many of the ways I think they died. So one is, we talked about the unnecessary and inappropriate hospital treatment with forced ventilators, not respecting DNR orders. There are many other things they did wrong in the hospital, such as mislabel people as being positive and then put them with other sick people, neglect patients because the staff either were laid off and they were purposely understaffed to maximize revenue, right? Or because they were afraid of getting sick from the alleged COVID patients. And then you had financial incentives for the hospitals to label people as COVID and also to use the ventilators. So all those things contributed to a lot of deaths. In the nursing homes, it was even worse, because they basically brought sick people into a nursing home like that should have been in a hospital, and everyone was scared there to get sick, so they basically neglected them, and there was a lot of deaths that occurred as a result of that. And then I wanted to get into the deaths that occurred in the community, but it seemed like you wanted to say something.